everybody, this is Dr. Kalpana Sringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. I am here today to talk about how you should be able to take care of a mental patient at home. During this pandemic, there has been a lot of problem because many hospitals are not admitting patients with mental disorders. They try to avoid admission because of the fear of the coronavirus and infections which can be carried out to other people. So this being the reason, I thought of briefing people and the public about how you can take care of these mental patients at home. See, psychological problems, as I told you in my previous videos, they vary from a very mild form like a mild sort of an anxiety or a phobia, and it can go up to schizophrenia or a bipolar disorder. When a person has anxiety, he or she could suffer from not able to communicate with people freely because of some sort of a fear within themselves. They cannot come out of it so easily. Some of them may get panic attacks. So panic attacks could be very, very severe at times. So when they have a panic attack, they become restless, they cannot sit in one place, they start moving around and they keep complaining that they're sweating, they cannot stand, they cannot sit, they cannot sleep. So in such a situation, how will you help a person who is in front of you at home? You may be living in an apartment or you may be living in an independent house. And people in India are so afraid of the stigma attached to mental illness. Supposing the person screams or says that he or she cannot stay in the house, well, what are you going to do? And how are you going to help such a case? You don't get panicky when you see such a patient. You just make the patient sit down. Ask the patient to drink a little bit of water or some juice and talk something other than anxiety to the patient. It is always better you don't keep reminding a person that he or she has a problem. Treat these people like normal individuals. Because the main aim of my talk is to bring these people to a normal stream of society. Unless and until these people are brought into a normal stream of society, it becomes very, very difficult. They will remain like what they are, and you will remain like what you are. That should not be the intention. You should try to help these people come out of their problem with ease, and they should try to start working. They should try to support their families and stand on their feet. And my NGO, that is Prakruthi Foundation, aims at this. We try to help people come out of their problems, stand on their feet, earn something, and take care of their families. The other example of illness that I can quote is a bipolar disorder. Supposing a person has bipolar disorder and he's in a state of mania, where he's extremely abusive, extremely violent. He can pick up anything, either a torch or a phone or a television. He can break that into bits. How are you going to manage such a case? Do you think you can restrain him by tying him up and isolate him in a room? Come on, this is not fair. They're all human beings. Treat them with utmost care. Don't isolate them. It's always good you be with them and explain things in a very nice manner. It is no use losing your temper, and it's no use you thinking that he or she is doing it purposely. They do not do it intentionally at all. It is the illness which triggers off such sort of a behavior. So as human beings, you have to be very, very humane in dealing with such people. Be very kind-hearted. Talk to them softly in a lower tone. Don't be harsh with them. Don't try to argue with them. Don't try to confront them. Supposing he or she has thrown something and broken a mobile phone, for instance, into bits. Are you going to confront a patient who has done this? No, you should not. Instead, seek help. Convince him. Tell him that what he did at that particular period was not good. Put it in a very subtle way. Don't label him. Don't say that, yes, you're suffering from this. No, he will not listen. There's a very faint difference between normalcy and abnormalcy. What is normal to you may not be normal to that person. What seems abnormal to you may be very, very normal to him or her. So deal with them in a very precise manner. Be assertive in what you say, but don't be harsh. Supposing you come across a patient with depression. He bursts into tears and says, I'm having this problem. Do you just laugh it out and say, come on, this is a very simple problem, and walk off? No. You have to be sympathetic. Try to understand what he or she has internalized all these days. Give them a chance to ventilate. Let them come out of their problems freely. Give them a very, very patient hearing. They should understand that you are trying to help them. Build a good rapport with them. And try to divert their mind. Take them for a walk. Take them to your garden. Play indoor games. Watch a movie with them. So these things will help them come out of their problems, apart from the medication that is really required. See that they sleep on time, see that they eat on time. And whatever medication has been advised by the medical expert, give it to them on time. Don't give them the entire lot and say, come on, you take it at this time. No, they won't be able to do that. First of all, they will not be compliant to treatment, because most of the patients will not have an insight into the problem. Many a times they have to be forced and given medication. See that they take their medication on time. Give it to them exactly. Supposing there are 5 pills that you have to give them only those 5 pills and keep the rest inside under lock and key. Don't keep those medicines wherever they can have access to it, because many a times they can just swallow everything if they are fed up of living. I remember a case, a lady who came to me with a problem. She had a pituitary tumor and she had a hormonal problem, and she was taken to a gynecologist for treatment. And whenever she would go there, she would have a mental breakdown. She'd become abusive, irritable, and she would have real bad mood swings. It would be very, very difficult to control her. So whatever medicines were prescribed to her, her people used to go and give the entire lot to her and ask her to take it on time. So this lady used to go on accumulating medicine. Supposing 5 pills were given to, she was asked to take 5 pills a day. She used to take only 2 out of it and save 3. So after about 5 or 6 months, she took all the tablets that she had accumulated and swallowed everything. She didn't get up in the morning. And they had to rush her to the hospital, and she was given a stomach wash. She was breathing, of course, but she had shallow breathing. They had to shift her to a hospital. She was given a stomach wash, and of course she came out of it. The reason why I'm telling you this is because many people who get fed up of living, they could do such things. So please avoid giving them all the tablets, and don't ask them to take it all by themselves. You have to take responsibility because that person is your friend or your family member. It is always better you sit with them, interact with them, and see that they come out of their problems. Supposing it's a case of schizophrenia. Those people will have hallucinations, they'll have delusions, they will not sleep, they keep talking to themselves because they keep hearing voices, they go on answering to all those things that they listen to. They may have negative thoughts, they may have suicidal thoughts. So all that you can do to these people is you medicate them, because even if you talk to them, if it's a burnt out case of schizophrenia, even if you talk to them and try to, tell them something, they will not be able to understand it all. So to such people, what you have to do is just see that they take their medicines on time, see that they eat on time, see that they maintain their hygiene. Of course, it is very easy to talk about how you can become a caregiver to such people. It's very difficult because these people will have a lot of hatred towards the key relatives. And the key relatives feel that these people are a burden to them. So they will not like to spend money or even on medicines. We have a few cases coming to us where the family members do not want to spend even a pie on medication. Of course, Prakruthi Charitable Foundation helps such people and we give them medication free of cost. I remember a case when I was being trained in NIMHANS. A patient used to be in the rehabilitation unit where he used to sit and weave from 8 in the morning till 4 in the evening. And one day I was sitting there to see all these cases. I had about 20 cases to talk to. And this boy comes to me and it was lunchtime. I asked him whether he had his lunch. He comes and shows his box. He had a little bit of puffed rice and a piece of jaggery. So I asked him, "Is this your lunch for the day?" He said, "Yes, this is my lunch every day. My people give me only this because I just get a very, very meager stipend, though I work from 8 in the morning to 4 in the evening. And they take away all the money from me, and this is the food I get." So I told him, "Come on, as long as I'm going to be here for the training program. You go to the canteen and eat whatever you want and give the bill to me." The fellow was so happy. And for all the days that I was there, every day he would be fed. And he was very, very happy. So this is what you have to do. You can't just give them something and say, "Come on, you're not earning anything, you're a patient and you eat this and you live." Such type of treatment will not help. There should be awareness in society. People should be psychoeducated. They should know what they should do when they have such a patient, and they should know why a patient behaves in that manner. What could be the cause of such behavior? So this is absolutely necessary for everyone. Awareness of mental illness should be, spread. People should know what it is. Only then will they be able to take care of such people properly. And you should never complain and say that this is what you are. You're not earning, you're not doing this, you're not doing that. You can't scold us, you can't do this. You can't behave in this manner. They're not doing it purposely. They have a problem and they're doing it. So try to help them, and medicines will bring their problems under control to a great extent. But a few residual problems could remain, maybe about 10 or 20%. That's okay, that's negligible. But if they are all right to about 80%, be very happy. They can manage their lives. And once they start improving, show them a way to earn something. See what interests them. Teach them that. Let them progress day by day. And then pay them something, motivate them, and they will be definitely fine. So this is what everybody has to do to help such people come out of their problems. In case you have any questions regarding how to take care of a patient who is at home, kindly contact us, and you can also visit Prakruthi Charitable Foundation for further help. Our psychologists and counselors would be ever ready to help you. Thank you so much.